Hi, my name is Robert Chelle with Chelle Law, and I'm an attorney that represents physicians with employment contract and independent contractor agreement issues. Today I'm going to talk about how to negotiate a physician contract. So, what are some areas where you kind of do have some leeway as far as getting changes made? What are some areas where you probably don't? And then, what are the best strategies when you're negotiating? So, first, and this is just a general strategy when you're negotiating anything, the person with leverage has a much better chance of getting things changed that they want. If you are in family medicine and you are just coming out of residency and you have no established patient base in the area, your leverage is simply less than someone who has already been working in an area for a decade, has an established patient base. If they move to a new employer, can likely bring over with them a bunch of patients and immediately be up and running without any ramp up period. So you just have to kind of have an idea of, all right, maybe this is not the highest leverage I will ever have, and then just acknowledge that and make certain that the contract that you get into isn't punitive when you leave and move on to your next job. So that's the first thing. Leverage matters. Next, specialty matters. Some specialties that are in very high demand give the physician high leverage as well. And this is regardless of whether they're coming out of residency, fellowship, they've been out a while. If you are in a specialty that is very difficult to fill, you simply will have leverage in negotiating the terms of your contract. Next, geography as well, where you are looking at. Someone who lived in a pretty desirable location in Arizona for a long time. Some people are kind of, surprised when they are negotiating a deal and the compensation is probably less in some of the desirable environments, maybe with even a higher cost of living than if they move to like a rural location, and simply supply and demand. The cities where more people want to live, the compensation will likely be depressed in some way simply because there are more options for the practices looking for new physicians. And so if you want to make the most amount of money possible, then look into a rural community that cannot get anyone to come and have to pay high bonuses, high student loan assistance, just a high guaranteed base overall. Those places are going to be more lucrative. I mean, there's super low cost of living, but then there are also locations that some people just simply don't want to live. So don't be surprised, even if you want to live in a high cost of living area, that the comp simply doesn't match what the cost of living is because there's so much competition for those positions. All right, now let's identify some things you can negotiate. Compensation is probably the easiest thing. Base comp, negotiable. If you're on a collections percentage agreement, the percentage of collections is negotiable. Signing bonuses, generally negotiable. Relocation assistance, it kind of is what it is. It's going to be somewhere between $5,000 to $15,000 at the most. You're not going to see relocation above that, except in very rare circumstances. So you need to be armed with some data if you're coming back to an employer and saying, well, I appreciate you offering me this, but I think I deserve this. You need to try to find the historical data from the MGMA or any similar services that can show this is the average compensation in the area, in your specialty. These are the average RVUs that are generated. This is the average compensation factor for those RVUs. These are the average collections. That data is out there. If you can't get to the data, then you need to hook up with someone who does have access to the data so that you're kind of fully informed of what's real and what's not. Now, one frustrating part for some people is they'll come to me and say, this job's offering 10,000 more than this other job. You need to look at a job holistically. It's not just the bottom line base salary number. Are you going to have opportunities to learn? Maybe some new skills that you can bring with you for the rest of your career. What are the benefits like? Are they paying for your malpractice? And if it's a claims-made policy, are they paying for tail? What's the signing bonus? What's the retirement like? What are the non-compete, non-solicit, all that type of thing? Do you have to pay any money back if you leave? The bottom line number of just how much you make in a year should not be the determining factor of whether you take a job or not. Now, obviously it's easy for me to say that, but especially for someone coming out of training, and I've been doing this for decades now, so I can at least give some advice, is just accepting the position that pays you the most generally never works out. The positions that will not completely beat you down immediately and make you hate your choices over the last decade is important. Having a good mentor, being in an environment where you can learn, not having an insane call schedule, like all of these things are pretty important when you're easing into, training into being a full-fledged physician who's making, a good amount of money. So there also has to be a point where you're willing to walk away. So if you're negotiating with someone and they basically say, take it or leave it, I find that those types of employers are very difficult to work with down the road. Meaning, if they just say, no, we're not changing anything, you either take the offer or get out of here. If there's something that comes up in a month, in 6 months, in a year, it could be anything. It could be a staffing issue, a schedule issue, a comp issue down the road if you think that you're owed, or at least would like some kind of raise, or a change in the percentage or whatever it is. The types of employers you just say, no, we're not negotiating at all, are very difficult to deal with in those situations as well. That is a red flag, and you should approach those jobs carefully. All right, that's a little bit about how to negotiate a physician contract. If you have any questions about your employment agreement or independent contractor agreement, feel free to contact my law firm. All my information is listed below in the description, and I appreciate you watching the video. All right, thanks. Take care.